If you ask me, can a community neurologist assess the cortical atrophy in the way like we did in this clinical trial, the simple answer is no. Because you really need a high quality MRIs and you need a high quality analysis to produce this data. But what community and academic neurologists should take as a take-home message from this study is that they should not rely just on the lesion development to lead to the clinically definite MS, but they should think that even in those people who do not have lesions and develop new lesions, they can develop substantial neurodegeneration in the cortex. As a matter of fact, sub-analysis of this study showed that cortical atrophy developed even in those patients who did not have gut-enhancing lesions at baseline, okay? So didn't have inflammatory activity. So I would say there are two messages that should be for the neurologists themselves. First, that the cortical pathology is not a late-stage phenomenon of the disease. It's a very early-stage phenomenon, and it's in a very short period of 4 years influencing clinical outcomes like his development of multiple sclerosis. So they have to take it into account. And second, that we have disease-modifying treatments like Aubagio, who already showed that from the early stage of the disease, we can delay this process. And I think by delaying this process, probably we can delay long-term disability. This is certainly to be shown, but I would suspect that this would be one of the ways why in number of studies as other phase 3 trials like TEMSO and TOWER, Aubagio showed ability to delay disability progression in patients with MS. Whether this has effect on cognition is also to be shown, but just to give you an idea, cortical atrophy in all studies that have been done throughout the years is the best predictor of cognitive disability in patients with MS.